Hi everyone! Welcome to Ask Me Anything. Well, Ask Me Anything is part of our Aphasia SG's Aphasia Awareness Month outreach program. And today we are into our third episode where we will be chatting with Jonathan Tang, a music therapist who is also our volunteer for Aphasia Choir. Well, what is Aphasia SG? We are a non-profit organization that supports persons with aphasia and their caregivers. Now, aside from Ask Me Anything, we also have very exciting programs this month. If any of you, have Facebook, you can check out our Connecting the Dots, which happens every Thursday. This coming Thursday, we're having a very exciting episode of Movie Club where a few of our members of our community as well as some volunteers will be coming together to chat about Bruce Willis's diagnosis and movies. We will be analysing his movie clips and basically trying to figure out when exactly he started to be really affected by aphasia in terms of his acting career. And next week we also have a very esteemed speaker, Dr. Chan Yao, who will be sharing his perspectives from a physician's point of view about aphasia. And if you're a caregiver, we have just the thing for you. This coming Sunday, there will be a free talk for caregivers about how to communicate better with a loved one who has a neurological condition, not just aphasia, but anyone who wants to learn more about the differential diagnosis, how different diagnoses like PD, like TBI and dementia can actually affect communication. All right. Now, without further ado, I am going to bring on board Jonathan. But let's see, where is Jonathan? Volunteers, different healthcare professionals. Hello.
Hi,
Hey, okay, sounds good. Yeah. So welcome,
great.
Jonathan. Yeah, and
Thanks for
Jonathan,
having me.
thanks for joining us. Okay, in case everyone doesn't know, and I think if you're Jonathan's friend, you will know, he's actually calling in live from UK. So the time difference is insane, right? It's daytime
Now
right
it's
now.
2 p.m., so it's really
Woo!
bright in my background. So let me
It's
just tilt
nice.
it
Yeah.
this way so the
Awesome.
the
Yeah.
glare doesn't get too much. Yeah,
Yeah. So, well, Jonathan, today's segment is Ask Me Anything, and all the questions will be coming to you, and it's gonna be about music. And actually, there is already a comment from Richard Spiro who said I could not whistle after my stroke in 2017. Interesting.
mm,
Let's address that later, okay? I think first, if you could just give us an overview, what is music therapy?
yeah. So, as I think Eve has already mentioned and so graciously introduced me, I am a music therapist, and what we do or who we are trained to use music. We are trained to design music experiences to help promote health and well-being.
Mm,
So it can range from anything from singing, from playing instruments, um, or even writing songs and different things like that. And we work towards different therapeutic goals. So for some people, it might be a more psychotherapeutic intervention where it's helping to relieve stress. It can be working in rehab where I'm working with a stroke patient or people with aphasia to help regain
mm,
speech or communication skills. Or it can also be working with children with special needs. So, for example, children with autism and using music as a medium or as a way to help maybe foster empathy or help to create social bonds or create a social connection with others. Or sometimes as a means for emotional expression in a way that maybe they're nonverbal, and so music can be another way that they can express themselves. So
right.
that's a little bit about me or what music therapy is.
It's really
Um,
cool. And to all viewers who just joined us, feel free to ask questions. This, like just type in your comment and we will take it. So just now there was a comment, we will address that
yeah,
whistling comment later, okay? But maybe if
yes.
you tell us why is music so powerful and so universal? I mean, it's
Um,
a very broad question, but
it is.
it is a very broad question. But so I don't know if you've read this book, but one of my favorite authors all time, right, and who's also a neurologist, Oliver Sacks, wrote this book, right, and you must have read it. So it's called Musicophilia. Tales of Music and the Brain. And he talks about music therapy also in his book. And because he's a neurologist, he works with so many patients, right? And
Yeah.
I'm just gonna put this thing out. So Oliver Sacks described how music can animate people with Parkinson's disease who cannot otherwise move, give words to stroke patients who cannot otherwise speak, and calm and organize people whose memories are ravaged by Alzheimer's or amnesia. Yeah, what do you think music is doing, to these different populations?
Yeah, so I mean, to add on, I think Oliver Sacks even wrote another quote. I'm not sure if it's in that book or if it's the one, a lady with a hat who mistook my
Yeah,
husband for hat.
yeah,
In one
yeah.
of those books where he wrote, where for some people, medicine is the cannot do anything, and that's where music is the only way to connect or only way to treat
Mm,
people. So, I mean, it can be there's so many ways to go about it. It's a very big question. So, if I want to explain it from like a neuroscience kind of perspective, there's no, if we think of the brain, specific to aphasia, we know that certain parts of the brain are affiliated with speech, language, communication, so the Broca's, Wernicke's areas. And so when those brain parts are damaged, we lose the ability to speak. But
mm,
unlike those certain cortices or certain cortexes that are involved in certain brain parts, certain functions of life, music, there's no music center in the brain. So if I were to play
mm.
like, I don't know if y'all can hear that.
Yes,
If I were to play music, if I put you in a brain scanner and if we were to play music, there's no one part that just lights up. There's no music center. But what happens is that the whole brain is lighted up. And that's because that just speaks to the power of music, that it activates the whole brain. All parts of the brain are involved in the auditory perception, in the physical sensations that we feel. So going back to the three examples, I think you mentioned one dementia, one stroke, and I can't remember the last one. Music. If I were to play, I don't know. Uh, let's say if I were to play, um, like a Chinese New Year song or something, it might evoke a certain emotion or a certain feeling for you, and that activates again from a brain stance. It can activate the hippocampus where memories are stored. If I was working for a stroke patient, like if I'm playing this beat, we can kind of feel where it is, and we can also anticipate. So even if I'm not playing right now, we can even think of that beat that's just going on, right? And I can even continue off where we left off, right? And it feels the same, and it just speaks to the power of music to activate this mechanism in our brain that helps us to predict what's going on, and that helps with stroke. For example, if you can't coordinate your movements, you're stuck, and so if you have this certain beat, yeah, feels like what Marcus said, feels like dancing with the beat, exactly. So the brain helps to predict when the next beat is coming, and so that helps to motor plan what your next action is. So like if I'm doing a certain exercise, yeah, don't worry if you have two left feet. I have three left feet. Oh, I can't dance. Yeah, same for me, right? So and I think even not just the emotion, not just the memories, not just the physical things, but I think the emotional aspect, right? Many people would think if I play, it can be maybe construed as something a bit more happy kind of thing, and then
Do you,
a bit more
yeah, do you suppose that's why?
sad maybe. Yeah,
Yeah,
Eve, go ahead.
yeah. I mean, I was just wondering, do you suppose that's why music is so powerful for our community, of patients with aphasia? Because there's aphasia choirs around the world. Why do you think music is so powerful, for somebody with a speech impairment, for example, apraxia of speech or aphasia, and
Right.
and is it triggering the emotions? You know.
I mean, I would say that it triggers everything.
Mm,
So for someone who is, if aphasia, if you have, if you have non-fluent aphasia, I think it's non-fluent aphasia, where you can't really speak or you are trying to find the words, right? So going back to the music as like a helping you predict when the next
mm,
timing or next beat is. So it can actually help to plan your sentences, right? There's stresses, unstresses, or if I were to speak, hello, my name is Jonathan Tang. You know, there's a certain beat,
Yeah.
there's a certain flow to it. So that can be one. It can also speak to the emotions. If I were to sing, you know, I don't know, I'm gonna go really old school here of like 甜蜜蜜我想着甜蜜蜜 right? Like that can be really powerful for someone to evoke certain emotions and make them feel really invested in it. And likewise, like I said, for you know, in music activates the whole brain. So for patients with aphasia or people with aphasia, you know, it bypasses those areas and helps with I'm going to throw in a big word here, neuroplasticity, right? It helps to rewire the brain or help you compensate for those damaged areas to help your brain rewire or find alternative routes that bypasses all these damaged routes to rebuild language skills.
Yeah.
Yeah.
This feels like a good time to address the comment that was brought up by Richard Spiro earlier about I could not whistle after my stroke in 2017. What, you know,
Yeah.
what do you think? I mean, you know, my first thought is it could be a motor, it could actually be a motor problem, like an oral motor problem. Yeah, but you know, what do you think?
I mean, I that was the first thing I was thinking too, and I mean, maybe if you're still here, it's Richard. I think if you, I mean, maybe were you able to whistle before? I think that would be something interesting to compare because sometimes stroke doesn't just affect us physically, right? Stroke can affect people's personalities. I've worked with stroke patients in the hospital that I was at, and spouses of the patients would tell me, my husband or my spouse is not the same as they were. You know, he's now more outspoken. So it can change people's personalities. There's something, it's an exciting branch of research in neuroscience or like personality neuroscience of how, you know, certain parts of the brain are really activated or affiliated with your personality in some sense. So I mean, my initial guess is more of a motor thing as well. Like, so this whole lips part, or I mean, Eve is the speech therapist expert on this whole area is so delicate. So to whistle, it requires a lot of control,
and
coordination, you know, exactly.
Expulsion of air coming out at the right time, you know. So it could be.
Yeah, I mean, if we were to break it down, there's so many things. That the breath control, there's the lip, there's the I mean, if you're whistling different pitches, right? So how much air?
And you're good at this.
No, I'm not.
I cannot whistle for my life. You're very good.
In music therapy, I had a teacher who is a professional whistler. Ooh. So he would, I mean, I went to a jazz school, so he was whistling and he would do runs in a whistle, and it's amazing. I can't do it, but anyways, that's just that.
I just want to say at this point, I mean, if anyone is listening, if you're a caregiver of your person with aphasia and you have you know, you're feeling a little bit scared about joining our choir, please try it out. You know, we do all these things as well. So like our warm-up comprises of oral motor exercises and you know, things that are not just singing. So it's great. Just try it out, have fun, which is what the whole choir is about. Yeah,
and I mean, we try to be not stressful. So at any level that you're at, I mean, not stressful. It's fun. We try to make it fun, and I promise we don't sing that old songs. We sing
Backstreet Boys. I don't know. No me.
Imagine there's no heaven. I'm sure we sing like stuff like that, a bit more modern stuff. Or I mean, oh, isn't she lovely? I mean, we also sing those kinds of stuff. We haven't gotten there, right, Eve?
No, not yet. But we've done Disney.
Oh, we've done Disney. That's right.
Yes, we have. Yeah, gonna jump. There's questions coming in about pursuing music therapy as a career, right? And there is a question here, but I guess oh no, wait, I pressed the wrong button. Okay, so hang on. Okay, there is a question here about how long does it take to become a music therapist? And I alongside with that, we have had questions on the back about, you know, what's the pursuit like? You know, what's the journey like?
So, I mean, unfortunately in Singapore, there's no music therapy training program as of yet, hopefully in the near future. So really for now, people who want to do music therapy have to go overseas. So it depends on how far you want to go. So I'll start with the furthest and I'll work our way closer to Singapore. So if you go all the way to the US, which is where I trained to become a music therapist, it's about a 3 to 4 year, 4.5, 5 year degree program. Bachelor's degree, you can become a music therapist through a bachelor's degree. If you come closer to Singapore, so in the UK, it's a master's degree. In Australia, New Zealand, it's all a master's degree. So you do have to have a bachelor's degree. And bachelor's degree in what, right? So it could be a bachelor's degree in music. It could be a bachelor's degree in psychology. I encourage you to check out those requirements before registering for that. Choir can sing better than can Shai. Cool. Yeah. And then I mean, there are many places to do it. So there's a few schools in Australia and the UK. And I mean, I think I would answer a related question, which is sort of like what is involved in training, right? What do we learn? So part of becoming a music therapist is that we do have to have good musical skills. You know, it's not as if I like can me, right? It's not gonna be that helpful. I don't think it's gonna be that helpful. So really working on musicality, musical skills, that's one aspect. And then you also learn the therapy aspect. So learning about different diagnoses, learning about different medical conditions and what entails. And then the last part is what I call music therapy. So music therapy and music therapy. So what is music therapy is where music and therapy, those components kind of tie in together. So how is music understood or used as a health tool? How is music used for certain clinical populations? And that's where you develop your skills, your clinical intuition musically, those kinds of things. And I'll broadly describe most music therapy programs to cover those three components. So yeah, even if you're not a great singer, I know music therapists who are excellent drummers. So it really music therapy is not about just singing or playing an instrument or being good at, you know, piano. I mean, I'm a piano player, so I know music therapists who are like drummers and they do a lot of drumming kind of interventions. And so finding, I think it goes back to like finding the best music therapist to fit your needs. So if you're in one sense interested in drumming and you know that maybe you have maybe some difficulty with motor skills, maybe drumming might be appropriate, and finding a music therapist in those expertise might be better than another music therapist like me who is more involved in like singing and doing more piano, guitar kind of bass stuff. And thanks for sharing.
And you know, Isvan0508, thank you so much for sharing. I think this might come as a surprise to, you know, some who are reading this. I can sing better than talking. I don't know if you have suffered a brain injury or a stroke, but certainly many members of our community also feel that way, that they can sing better or they can actually verbalize better when there's music, you know, in the background and helping to facilitate verbal output. So yeah, the wonders of music therapy and music, really. Jonathan, I think what you shared earlier on, there's two other related questions. So one is, how is then a music therapist different from a music teacher or a musician? That's question number one.
Cool. Richard Spera, I just wanted to say thanks for participating, and I'm glad that you were able to whistle.
Awesome.
Great. Yeah. So your question is, what's the difference between a music therapist and a music teacher?
Or even a musician, you know?
Right. So I think if I were to put it broadly speaking, so if I'm a music teacher, if I go to a music teacher, they will focus on technical skills, right? The goals are different. So a music teacher might work on, for example, if I'm playing some classical piece, so they might say, no, that sounds so harsh, make it sound smoother. You know, so they're focusing on the technical aspects of music, maybe. As opposed to a music therapist, we might do the same thing, where I might be teaching you how to play this piece, but my goal might not be to like slap on the wrist kind of thing, like, hey, make it smoother. right? It really is tailored to the goal that you're working on. So it might be, for example, if you're using that piece for kind of like a fine motor dexterity kind of thing, then I would focus on, how your fingers positioned. So I'm gonna scroll down. Yeah, we can see that. So I might focus on how, can you see that? So I might focus on how, how your fingers are moving, and I might do some exercises for that to help with motor dexterity. And if I'm working on something else, then I would design the intervention accordingly. And then I think you mentioned about musician, different from a music therapist. I always liken it to, I like to compare it to like gym trainers, right? What's the difference between going to a physiotherapist versus a fitness trainer, right? So music therapy and musicians are kind of like the same thing, where they might have had some training. I mean, nowadays there's so many arts for health programs out there, and NAC, the National Arts Council, has a lot of programs out there, and a lot of great work are done by musicians. But going back to training and level of expertise, a fitness trainer, gym trainer might not have the necessary skills to treat people with disabilities or people who have a diagnosis, as opposed to music therapists who are trained and are able to better guide the music experience. So they might be great musicians, right? They can be great jazz musicians or whatever, but in terms of using that tool towards a certain health benefit or a certain therapeutic outcome, they might not be the best person. And so my recommendation for people out there are great arts and health programs out there. So please go out, check out National Arts Council. There's quite a few that I saw, which are really exciting. But if you do have a medical condition, if you do have a diagnosis, if you do have something of concern, and you think that you need specialized help or specialized treatment, that's where I recommend seeking out a professional, a music therapist specifically.
Okay. Yeah, so what I'm hearing is, I think to sum up, the training is different, right? Because you guys go really in depth in learning about the medical conditions and diagnoses, and then also the goals, right? Basically. Awesome. So I think there's a question here from Charlene Wee who asks, do all musical instruments have the same equal beneficial impact for patients in music therapy? It's a great question, since you said
it is.
Yeah.
My short response will be no. But if we break it down more, so for example, if I work with a child with cerebral palsy, for those that don't know, cerebral palsy is where you're tense, you have certain muscles that are tense, and maybe working on fine motor skills like grabbing, I wouldn't necessarily, hey, let's work on the piano, and they'll probably let me model it here, their fingers might be so tense that they can't do it specifically. But so as a music therapist, I'll then design or intentionally use specific instruments. So I might use a mallet, and that's where even music therapists, we're not alone, we co-treat or we work with occupational therapists. So I remember working with this occupational therapist who provided like this foam grip for one of my mallets that was really, really thin, and that helped to work on grabbing. So after working a bit more, and then slowly we smallened that thing, the little foam thing, and eventually that my client was able to hold the mallet. So it really depends on what the aim or therapeutic goal is. And so again, I want to stress what I said earlier, that as music therapists, we design the music interventions intentionally, in terms of what the client wants to achieve, and how we can use music intentionally in that manner.
Yeah, so it's always customized. I mean, versus what you mentioned earlier, the NAC programs, which are really great, but for the masses, right? So if you more customized therapy and treatment intervention, seek out a therapist, right? I mean, for everything else like as well as speech,
Exactly.
There's a really good question here about. Somebody said one of the IG stories question was, I'm considering music therapy as a career, but I'm really not sure if I'll make a good therapist. What are the qualities of a good music therapist?
Wow. It's a hard one. I think for one, I always go back to the music So music is really important. So if you have good musical skills, or see yourself really putting a lot of effort into developing your musicality, I think that's one thing to be one criteria or quality of a music therapist. I think other aspects are not specific to music therapy, but generalized across all helping professions. So having empathy, having empathy to work with clients, sometimes also having tenacity, I want to say, to be able to withstand, when you meet certain clients, the conditions might be so devastating that it can really influence or affect you. So having that resilience or tenacity to bounce back. And I think most importantly, I want to say self-care, being able to know when to say, hey, I need a break. Especially I've worked in Singapore, and we all know the working environment can be really stressful. So finding the time to take a break, to rest, recharge, so that you can help the next client benefit as much. Yeah.
From Annie, since you brought up Pete, what's the applications with a wider pediatric community, ADHD and ASD? Oh, of course, we're not going to ignore it. It's ask me anything. You can ask anything.
Yeah. Yeah. So I like I said earlier, I think music therapists work in a variety of settings. So stroke aphasia is just one. There are music therapists that work in a pediatric hospital. They also work with special needs. So for people of ASD, it might be using music as an alternative communication tool. If they don't have language, if they don't have speech, music might be a way for them to communicate or to convey certain things that they are feeling. For ADHD, it really depends on the goals, maybe to help them focus. I mean, we all like to think ADHD, attention, so deficit of attention, so working on attention. But maybe it might not be attention, it might be a motivation. So something that when I was training or having supervision, we like to say that music therapy, we don't make people do things, but rather we foster their intrinsic motivation to want to do things. So for people of ASD, we are encouraging them to explore and use their intrinsic motivation to want to connect. And they might not know how to connect, and we might not know how to best connect with them. And so music then becomes that intermediary where we can find a common language of common area to connect. And that's finding those areas, those niches that we can join and have a moment of connection.
Well said. I like that. I'm not sure if I shared with you before. My very first interaction with a music therapist was actually during my clinical placement. That's eons ago, right? In a special needs Singapore, and I was so blown away with me, like how music and how she was fantastic. I don't think she's in Singapore anymore. She worked with the ASD children who are non-verbal, very severe, and it's amazing. It's amazing, yeah. So thanks for the question, Annie. There's from Marcus. I'm just gonna put it up. He said, "Hi, does music therapy help different speakers differently?" Wow, this is student. I think that's why he's asking a question like this. But I'm curious to know the answer also. Yeah. And because
I'm not sure.
UK right now, and they're also a melting pot with busy people from everywhere. So yeah.
I mean, I'm not sure if Marcus, you're asking this more from like a cultural perspective or like from a language perspective. So if I'm working in Chinese language versus Malay or English language. So I mean, there is research for us Mandarin speakers or tonal language speakers that we are better at perceiving pitch, or that more of us have perfect pitch. Yay, yes to us. So in terms of, I don't think there is actually, I'm not aware because it's not my research interest. I haven't really read into it, but I'm sure that there is some benefit for tonal languages. For example, if I learn certain pitches, and that helps with perceiving pitch or perceiving language in that sense. There is a couple of studies that I'm aware of. If anybody's interested, I'm gonna go very academic now. It's by Feilin Shao, HSIAO, I think. She worked with cochlear implants, Mandarin speaker cochlear implants. And what she found was that I think they did improve more with music therapy as opposed to a traditional speech therapy approach. And just because music really helps with the pitch perception, I think, or maybe it's not necessarily language improvement, but that they were able to perceive pitches better than other deaf bilingual people. Yeah, so that's probably, so music therapy help different speakers differently. I would say yes, probably, for sure.
Yeah, it's a great question. I've always had wonderful experiences working with music therapy co-treatment. So it's amazing. I wish I wish I had an instrument, but yeah, I
yeah, and for those out there that you say, I think like just now that question of I want to be a music therapist, but I don't know if I could, and if you're not musical, maybe music therapy is not the right way, but you can work with us. So becoming like a counselor, psychotherapist, or what kind of helping profession, you can always, at least I can speak for myself, I think most music therapists are open to collaborating and working. I've worked with Eve for so many years, and there are so many opportunities that we can, I learned so much from Eve about working with aphasia.
So much, from you and Michelle, it's just amazing. I think there's so much to learn, transdisciplinary, right?
Yes,
and
exactly.
Healthcare is going. I think we have time for one last question. Question here from Jeannie, who asked, what is something surprising about music therapy, or perhaps I can rephrase that. Can you share something memorable about your treatment in the journey of your entire career as a therapist? Maybe something memorable patient that you've worked with.
There's so many I want to say.
One.
I think I'll share like one of my very early experiences, because I think that for me solidified why I wanted to do music therapy. And so again, like I think like you, Eve, one of my first placements was in a special education setting. And as part of the training, we have to pick a case study client. We had to write a case study, develop goals, and work through it. And so imagine this almost 10-year-old child, nonverbal, and through working with him, by the end, he could say hi and bye to me, which was really impressive. And that's, imagine, up for 10 years, and I've worked with him for barely 10 weeks. And to see just that, that change is so, I think it's really big.
Huge. So, I don't know, grateful. I don't know. Everyone's so grateful, whatever.
Yeah.
Amazing.
Yeah.
Wow.
But it was such a, just that, working from, he was just like just grunting to, I dare say, an audible hi and a bye kind of sound, which was really, really very nice.
That's just so heartwarming. Yeah, I
love it.
Love that story. Yeah. Yes, yeah. So it is 9:30. Shall we end the session with a musical interlude?
We could. Yeah, but thank you all for coming. And
all questions.
Thank you.
If you have any session, drop us more comments, ask. I think they can. Yeah, but yeah, not to worry. It'll be on our feed.
Goodbye to everyone, and thank you for coming today. What's the minimum requirement? Priscilla, I would say, listen back. We did answer that question, so kinda, but yeah. Goodbye to everyone. Bye.
Bye. Thanks, Jonathan. See you around soon.
You're welcome. My pleasure.
Have a great day ahead in the UK. Bye-bye.
Thank you. Bye-bye.
Bye.